All right, we're looking at multiple deaths owing to heart attack in Karnataka. That's led to the Karnataka government now ordering an official probe into why young people are dying of a heart attack. Could it be linked with the COVID-19 vaccine? 23 people have died of heart attacks in just 40 days in Karnataka's Hassan district, many of them young, who are fit, middle-aged, no prior illness. And then 4 deaths that have happened just in the last 24 hours has now finally triggered the alarm. Chief Minister Siddaramaiah has gone public. He's raised several questions, including that these deaths, could it be linked to COVID-19 vaccine? He asks, why are so many people dying young and so suddenly? Well, a lot of questions being raised about cardiac arrest linked to COVID-19 vaccines, though there are several reports that have come up now that quash these claims. In fact, Siddaramaiah now, with that very doubt, has set up a medical team to probe this matter. That team is led by Dr. C.N. Ravindranath of Jayadeva Institute of Cardiovascular Sciences. The expert panel has about 10 days' time now to investigate and submit its findings. But the Union Health Ministry is quite firm. The centre says there's no link to COVID vaccine and there's nothing to panic over it. In fact, it says studies by the ICMR and AIIMS show no evidence that COVID-19 vaccines cause sudden cardiac deaths in adults. They say India's vaccines are safe, serious side effects are extremely rare, and sudden deaths are being studied separately. They're currently under investigation, and there is surveillance that's underway to see why, if at all, people are dying suddenly. Basically, if at all it's linked to the COVID-19 vaccine or not, clarity will come post these reports now coming out. Karnataka's health minister says there's no clear-cut link that's been established so far with these deaths to the COVID-19 vaccine. Let's listen in to Dinesh Gundarao there.
These things cannot be concluded by us. This has to be done by premier research agencies and big research agencies, so which they are also doing. So far no clear-cut findings has come of the impact of COVID vaccination on whether myocardial infarction, heart attacks, cancer, all those things. So far no direct linkage has been found.
Well, why this gets all the more scarier for Karnataka is that this concern that was, we thought, limited to only Hassan has now spread across Chitradurga. In Chitradurga, in just 2 months, they've seen 37 heart attack related deaths among young people. That includes 23 men and 14 women. The total number of cases in Chitradurga alone of heart attack are 186, though fatalities, as I mentioned, are 37. What's really going on here? If I could bring in our experts on the panel. Sunila Garg, former member, Lancet Commission, COVID India Task Force, joining us. We also have Dr. Sanjeev Ghera, Director and Head, International Cardiology at Fortis Healthcare, Interventional Cardiology, beg your pardon. And also Dr. Surendra E.M., the Secretary, IMA Davangere. I really appreciate all of you for joining us at this point. A quick understanding, if I can have, from Dr. Sunila Garg. Sunila, your take on this suspicion that these sudden heart attacks could be linked to COVID-19 vaccine, and these are questions not being raised from today or yesterday, and not just because of Karnataka sudden heart attacks reported in one district. But since the time COVID hit, since the time vaccines were taken, there have been n number of deaths that we can count, which aren't explanatory. One can't really establish why the person died, hardly any comorbidities. Young, fit people have succumbed to a cardiac arrest or a heart attack.
Thank you, Nabila, first of all, for having me on the show. And the second part is that you said that why so many deaths in a particular district or in an area. But we must remember that India gave almost 220 crore vaccines.
Yeah.
And we are talking of 2 doses of vaccine along with booster. Okay. The one thing which is very important to remember is that how 1.4 billion fought against COVID was that we gave vaccines, and the vaccines prevented against hospitalization and deaths. And this is not the, kind of one-time observation. This is the observation throughout when we are talking of 2020 onwards. So basically we have to look at, and plus another thing which I want to bring out to your attention is that, and to everybody's attention, that when we introduce any vaccine, whether it is COVID vaccine, which of course, was developed after going through all the phases of trials, We didn't compromise on anything. That is one thing which is important. And the vaccines were on different platforms. So vaccines were safe. That is important. But if you say that every vaccine is 100% safe, right from childhood vaccination, that is not correct. So that part is important. So we have to look at other factors besides it. Now we are looking more younger deaths otherwise also as well, because of obesity, because of lifestyle changes, because of genetic predisposition. And I think 2 to 3 days back, we lost, one of the, models as well. Basically it was because of she was fasting, trying to lose weight. So that is where there are so many factors which you have to take into consideration. If gym is allowed for, let's say, half an hour, people are going for 2 hours and above. So that part is very, very important. So, cause and effect relationship is very important. And our ICMR study, along with Government of India and AIIMS studies, already brought out this fact that we need to look at many factors beyond,
But
because it's just
what then, ma'am, does it,
just
what then really explains the United States now deciding that no more COVID-19 vaccines will be given to at least children? Their children will not need to take it. Only those with comorbidities, etc., may have to take it. They've really reduced giving
definitely
out
you brought out a
vaccination.
very Yeah, you brought out a very important point that children will not be given. Because in children, the infection is very milder and it tends to subside. That is why it is important. And in India, we did not vaccinate children. That is important part to remember. But then in
We did. We did
quite a number
vaccinate
of
children.
countries, yeah, no, we did not say particularly when we talk of less than six
No,
months and all
but we
that.
had
And
7 years and above were allowed to get
yeah,
vaccinated.
that's good. So when we look at particularly under fives, we did not do that. Number 2 point which you have to remember is that we went in a very scientific manner. We first vaccinated our healthcare workers, then our elderly people who are comorbids and all that, and then we came down. And also amongst that, we first vaccinated people who are suffering from comorbidities like
Right.
diabetes, hypertension, and all. And you will appreciate, Nabila, that the extent of obesity which is existing now, even our Prime Minister talked, I think few days back, that people should be cutting by 10% in their oil because we are having so much of obesity. So that part we have to look at in detail, and let not the message be going, and let not be phobia created in minds of people that you have been vaccinated and now you are going to have heart attack. So that important point I want to bring to this platform. So important is that the vaccines prevented against hospitalization, which is a well-known fact, and also deaths. India had very, very less number of deaths. People, asked us at that point of time when vaccine was not accessible also to people. People were asking for vaccines. Why not vaccine for young people? Why not? And then at that point of time also, I remember doing several shows also that vaccine will be available as per the availability and as per priority also. So that part has to be remembered. So we have to really look at in depth into other factors which are responsible for, as you know, that we do have a huge burden of lifestyle diseases which is there. So cause and effect relationship is very, very important and needs to be looked at in these cases, because then only verbal autopsies become very crucial at this stage. Thank you.
All right, ma'am. Dr. Sushil, I will come to you. Stay with us. Dr. Sanjeev Ghera, Director and Head Interventional Cardiology, who's also with us. Doctor, your take on sudden deaths among youngsters. What would you say and how would you explain these deaths? In Karnataka's Hassan itself, nearly 40 odd people who've died in barely a month. Now, do you believe that the celebrity deaths have induced this certain amount of fear in people, and that fear and panic could also accelerate a heart disease? Is that a possibility at all? Do explain.
Hi, good evening. But I really agree with Dr. Garg. The COVID vaccine should not be blamed for all these sudden cardiac deaths or heart attacks. It has been very clear from the evidence that only mRNA vaccines actually gave some patients myocarditis and pericarditis, which could lead to sudden cardiac arrest or sudden cardiac deaths. But we should be very clear that what is heart attack and what is cardiac arrest. So sudden cardiac arrest is never actually, sudden cardiac arrest can be very immediate type of thing, a fatal type of thing, but heart attacks actually give some type of warning signals initially, and just a panic, just a fear because of some celebrity death can't actually lead to sudden cardiac arrest. There has to be some pre-existing condition. There has to be some predisposing factors like
Does
genetics.
panic trigger a cardiac arrest? Can panic
Yeah,
trigger a cardiac arrest?
panic can definitely trigger heart attack or cardiac arrest, but there has to be some predisposing condition earlier, like some high cholesterol, high BP, or high sugars, inactivity, heavy smoking. Then panic can cause sudden surge of catecholamines or excitatory hormones, causing more of high heart rates, and causing heart attack or heart arrest. So sudden cardiac arrest can be because of rhythm disturbances, but heart attack can cause sudden cardiac arrest. Heart attack always gives some warning signals. There has to be some angina, like chest pain on walking, fatigue on walking, or maybe some breathlessness on walking. It is never sudden, actually. 95% of people with heart disease or silent heart disease, they have some type of symptom, or maybe some test is abnormal. There has to be some pre-existing condition over there. There has to be some substrate over there, inflammation type of thing, like what I told about the risk factors like diabetes or high blood pressure, ignored high blood pressure, or high cholesterol values, obesity, physical inactivity, heavy smoking, heavy alcohol, drug intake, binge intake. What actually happened with that celebrity, and any type of addictive thing, and especially when you have genetics with you, like your father or grandfather, they had heart disease or they were operated for heart. So this means that there is some milieu, there is some substrate in you, genes in you, so that any panic, any type of trigger, actually excitatory trigger, can cause heart attack, and heart attack can cause sudden cardiac arrest. So sudden cardiac arrest is actually a fatal thing, which actually can't be prevented. Around 70 to 80% of people who do not get CPR or shock therapy during cardiac arrest, they don't actually reach hospital. But heart attacks are never sudden. There has to be some warning signaling.
Dr. Surendra, who is from Karnataka itself, Doctor, you want to chime in on the number of deaths that have been reported in Chitradurga and in Hassan. It's alarming to hear that in barely a month's time, 40 people have died in Hassan, 37 in Chitradurga. These are big numbers, and which is why it raises an alarm. And if Siddaramaiah, the Chief Minister itself, the head of state, raises questions about the COVID-19 vaccine, then citizens are bound to take note.
Yeah. Thank you to be on this part of the discussion. See, first of all, the report of vaccine causing such a problem is very, very unlikely, because one is the preliminary reports have already shown that there is no such links. Anyway, the further follow-up has to be done on this to have a clear picture on this. Nevertheless, rather than only blaming vaccine of those people who have already taken vaccine, we cannot do much about that. But what we can mainly rely on is what is our dietary pattern, what is our stress level, what type of food we are eating, and where we can prevent on all these things. So probably the focus should be more on how we can prevent such a problem in future, and thereby saving our younger people from getting such a drastic events. So it is very important that nowadays we are eating the food what we eat, not only the oil. Though Prime Minister has mentioned, there are so many other certain foods which are like a inflammatory foods. Like means there is some taste makers are being used, and there are some food additives are being used, and the dairy products also. How we are eating the dairy products, by they increase the dairy production by giving so many hormones and some chemicals, and the same thing we are eating. So this can cause lot of inflammation in our body, which can definitely create some inflammation on the endothelium of our coronaries of the heart. That can increase the probability of the clots in the arteries. So like that, and our stress factors also. So these are all the factors which we should, of course, there may be some genetic factors, but still there should be some light should be shown on all these factors, and thereby we should try to prevent such things happening. And now coming to the increasing in the number, probably there is a reporting of these cases have been become more vigilant, and we are trying to see such cases being enrolled or maybe reported.
Right.
So that is maybe one of the reasons.
Dr. Sushila, I would like to ask you, there are reports that suggest that about 1 to 13 people per 1 lakh odd who took the vaccine may have reported, or as per reports, they may have observed to have inflammation of the heart muscle or the lining. Have you understood this complication? Has this come to your notice? These are published online.
See, Nabila, this is basically, as was pointed out by Dr. Gera also, that this is because of a particular vaccine, mRNA vaccine from
Yes.
Pfizer company.
Yes.
And over a period of time, this was proved also. And then Pfizer company agreed also. Because that is where, but India never agreed to Pfizer vaccine and we never took that. Because first of all, it was very, very expensive, thank God, and we never had that conditions to store the vaccine. But ultimately, we realized we had got our own indigenous production and we were all, able to vaccinate so many people, and which is a success story. And not only in India, we also exported the vaccine to many countries. So if a particular phenomena is happening in a particular district, geographical district or adjacent district, we need to look at far beyond other factors about genetic predisposition, about other non-communicable diseases, lifestyle diseases, and as was mentioned earlier also, we have seen increased intake of tobacco as well, which leads to and I'm particularly, I will not be able to comment upon the population perspective, basically with regard to those, because we need to go in depth before I comment upon that. But tobacco use has also become rampant along with alcohol. So lifestyle, diseases are particularly, we are seeing more and more. And day before when I was talking about Shefali Zariwala and all, we realized that particularly when we look at the youngsters now, we are going by, excessive gymming, but we also go by the advice of a gym person that take these proteins, take that protein, so this has become, in rampant, we should take the medications only when prescribed and according to the dose. If we take excessive amount of anti-diabetic drugs, particularly like metformin, which will lead to hypoglycemia, and also hypoglycemia is much more dangerous. That is also important part. So we need to see that, basically go in depth, and as I said, verbal autopsies will definitely prove that. But at the same time, let people not panic that they have taken the vaccine, so they are going to suffer from something. Yeah.
Though I still would like to ask Dr. Surendra and Dr. Sanjeev. I'll start with Dr. Sanjeev. What really are the triggers in your view then, if it's not COVID-19 vaccine? And in fact, as much as I read, the more I understand that you have every possible body that has said that there is no connection of heart attacks with the COVID-19 vaccine, be it ICMR, AIIMS, WHO, CDC, all have found no direct link of COVID-19 vaccine to heart attack. In fact, reports suggest that having COVID-19 itself is a higher trigger to heart health or a heart attack, but the vaccine as such is not the problem. In fact, it could help prevent it. Even a study in England that's involved 46 million people also suggests and found that COVID-19 vaccine, if anything, lowered the risk of strokes post the vaccination. So, well, let's see and hope that Siddaramaiah's fact-finding committee there manages to come up with a report. But is that report, or can that report be substantial enough? Dr. Sanjeev, are we really in Karnataka geared, in your view, geared enough, equipped enough to understand if there's a link to the both?
So I think vaccine link is not very clear, but when we talk about trigger factors, like in my emergency, we always get around third or fourth patient is young. He is below 40 years, he or she, and even women are also getting heart attack. So when we take them to our cath labs and we do angiographies, we see that 40%, 50% blockages even can get ruptured, and it can cause clot formation over there. So what are the trigger factors? Actually, trigger factors, what we see from the history when we talk about, when we talk to their family, their pattern, lifestyle pattern, their dietary pattern, or their activity patterns. So most of these people are actually corporate IT people who are not walking enough. They are not sleeping enough. And they are actually binging on some processed foods. And then always pollution is always, a thing over there, which is actually being investigated, whether it causes inflammation in blood vessels and cause heart attack or clot formation. Other is binge smoking, binge alcohol, any type of addiction, or taking up of any exercise, unaccustomed exercise, which your heart is not adapted to actually. You suddenly hit gym and lift so much of weight, and you can actually cause 50% of silent block which was lying there. It can get ruptured and cause heart attack. So there are so many things which needs to be investigated, and especially in that area in Karnataka, what we are talking about, we need to actually investigate the previous history, genetics, their pattern, lifestyle pattern, and their dietary pattern, their addiction to something, or maybe some trigger factor which actually cause these heart attacks. But we actually definitely can't link all those deaths to a simple COVID vaccine, especially after 3 years of getting that vaccine.
All right. A final word, if I could bring in Dr. Surendra, on that. Karnataka at this point is really hoping to find an answer to these sudden deaths. But if I really look into the lifestyle, I would still be surprised, or maybe not so surprised, if this report came in from an urban area. A district like Hassan, Chitradurga, one would assume is slightly more laid back. When I say laid back, you don't have an urban lifestyle there enough to access junk, enough to go into heavy machines and protein shakes. And I'm assuming most of that happens in an urban setup, less in a setup like Hassan or Chitradurga, which is why it's worrisome. These are people from, who have homes there. They have healthy eating habits. So what could really be the reason for Chitradurga and Hassan to have the highest number of heart attacks?
Yeah. It is a myth that only the urban people will have the
Bad
food habits,
lifestyle?
or lifestyle will be. See, even in rural areas nowadays, we are seeing a lot of people coming with young hypertensive, young diabetes, and they will have high lipid profile levels. See, these are all because of the lifestyle modifications has not been properly followed, both in urban as well as in rural areas. Even in rural areas nowadays, we are seeing people are having almost similar work pattern what people live in the urban areas. That's a very astonishing, and also you may feel that rural areas people may have a good dietary habits. It is not so. It is the urbanization taking place even in rural areas also. In the sense their lifestyle, their food habits, and other
We got your point.
patterns
So,
are.
do you believe that Karnataka doctors that Siddaramaiah has tasked with this important report are equipped enough to find or get to the bottom of this?
Yeah, definitely. Definitely, there are well qualified and very senior people have been included in that, and definitely they will come out with uh, clear picture in a short period of time.
Okay. Dr. Sushila, a last word for you. Of course, a lot of questions being asked on whether or not COVID-19 vaccines should still be taken, or are we done with it for good now? What's the deal here? There was a time when they said you got to have annual vaccines, 2 doses, but no buzz around that now. Why?
No, Nabila, it's not like that. Why you see we saw few strains of virus which were mutated strains now, and which was spike protein mutation, but we also were also of the opinion that all of us have suffered from Omicron variant infection, and all of us have also got vaccination. So that is where we all did not suffer from infection. Very few people who suffered and who succumbed to the infection were the ones, particularly in state of Kerala and Tamil Nadu, and 21 states the virus was seen, and we saw more number of cases over there. So they were all, quite a number of cases were suffering from comorbidities, and that's where, when we were listening to all, it is very important to probe much more into the depths. That is important part, and we need to look at, you said that basically the district is different. Now we see more of sedentary lifestyle also. If you talk of rural area, we talk of couch potato syndrome. You saw eating of multiple fried time samosas or chips. They're available everywhere. So ultra processed foods are consumed everywhere. So we need to see much more in depth, and we need to see. And in many countries, let me tell you, being part of subject expert committee, they've included COVID vaccine as part of their annual vaccination. But it will depend on the strain, because all the platforms are ready, and we can make the vaccine anytime if required, but it has to be as per the strain. It is not that every time the same vaccine is going to work
Yeah.
because the virus mutates very fast. So we have to be accordingly prepared. Thank you.
All right, ma'am. Thank you very much. I really appreciate all of you for joining us with your very valuable thoughts. These are concerns that need to be addressed, and you've done just that. There is no direct link to the COVID-19 vaccine with, of course, the sudden deaths, heart attack that's been reported in Karnataka. This is at least what the experts say, but we're waiting for the Karnataka government now to come back with its report in 10 days' time. Of course, we here at News 9 will give you an update on that.